quickly, I'll start with introductions. Are you ready, Jasmine, for our secret question?
Yes.
Okay, fantastic. We're just going alphabetically, so we'll do it this way. First, I'm going to introduce Daniel Aldrich. He is a professor and director of security and resilience programs at Northeastern University. His field of expertise is the role of social networks and social infrastructure in crisis and disasters. His current research interests are, can we map our community's social infrastructure in the same way that ASCE maps the nation's bridges, roads, and ports? All right, Daniel, the question for you is, what is your star sign?
My star sign?
Mm-hmm.
I'm a Taurus, I believe, if I'm born in May. So a Taurus.
A Taurus, and Jasmine's going to give you the characteristics of a Taurus, and I need you to tell us which one does or does not reflect you the most.
Okay.
Well, so Tauruses are patient and reliable, warm-hearted, determined, and loving.
I think of those, I'll go with determined. That seems most able to be empirically verified.
Okay, empirically, I like it. Very empirical. All right, next up, we've got Jack. Jack Harold is the emeritus professor at the George Washington University and Virginia Tech. His field of expertise is in risk modeling, risk modeling and crisis and risk management. And his current research interest is, why are we still unprepared for the impact of rare but foreseeable events? And Jack, what is your sign?
My sign, Leo.
All right.
All right, Leo are generous, creative, enthusiastic, and faithful.
What was the last one?
Faithful.
Okay.
Which one reflects or doesn't reflect you the best?
Enthusiastic, I think, probably.
Is that a yes, it reflects you, or not reflects you?
Yeah.
Yes,
Yeah.
okay. All right, moving on to Duncan. Duncan Shaw is a professor at the University of Manchester. His field of expertise is community preparedness for disasters. In other words, spontaneous volunteers, vulnerable people, disaster household recovery, and community resilience. And his current research interests are how recovery, renewal, and resilience to COVID can be enhanced, and operationalizing community resilience as capabilities. Duncan, what is your sign?
Virgo.
Virgo are modest and practical, diligent, analytical.
I'll go with practical.
Practical. All right, we can use some practicality. This is good. All right, next one we have is, correct me on the pronunciation, is it Jiwon-ju, or how do you say that properly?
It's Jongwon-jo.
Jongwon-jo, okay. Jongwon-jo is a PhD student at Pennsylvania State University, and her background is in technology management, data, text mining, and user experience research, as well as investigating how local communities support each other during COVID-19. Her current research interests are, what motivates local communities to support one another during disaster crises, and how can digital technologies effectively support community-based disaster relief? And what is your sign?
Mr. Green.
Green, what month were you born in?
Oh, okay. April.
April, when? April would be a Aries.
Aries or Leo, I think.
Leo is in August.
Oh,
So,
never mind, not that.
so Aries, we'll take that. So Arises are adventurous, energetic, confident, and dynamic.
Which one of those characteristics best represents you?
I think energetic.
That's a good
Great.
one. All right. And Miguel, is it Martello? Is that the correct pronunciation of the last name?
My first last name is Yaller.
Yaller, Miguel Yaller Martello?
Yeah.
Okay. Thank you. All right. And Miguel is an associate professor, transportation engineering, and co-director of Sustainable Freight Research Center. He's from the University of California, Davis, as you can see from behind him. And his field of expertise is disaster response operations, sustainable transportation systems, and supply chain management and logistics and freight modeling. All right, and what is your sign?
Also Leo.
Also,
Also Leo, generous, warm-hearted, broad-minded, expansive. I love my job today.
Do you say expensive?
Expansive, like
Okay.
He's like expensive.
Maybe both, expensive and expensive.
All righty, I like that one. Tiffany hasn't joined us yet, so we will move on to Garrett. Garrett Foreman is the Director of Programs for the CCL, the Creative Crisis Leadership. Garrett did not fill out his field of expertise, so we're going to go straight to his star sign.
I am a Taurus, on the cusp of Taurus and Gemini. I'm on May 20th.
awesome, as you heard, patient, warm-hearted, determined, security.
Which one reflects you the best, Garrett?
I've always thought of myself as Taurus, especially now that both my son and daughter are also both Tauruses.
All
Or
right.
Tauri.
Well, and I know they just changed the star signs, and a lot of people were really confused about that, so that makes sense.
Did you? I didn't know that.
Yeah, they swapped them over. Some people got moved. All right. Suzanne, you ready? Suzanne Yule, she's the founder and driving force behind Creative Crisis Leadership, so we probably all know her. She's got a pretty diverse background in theater arts and computer science, human-computer interaction, and user experience and design, as well as disaster response. And her current question, and the driving force behind CCL, is how do we routinely get groups of strangers to coalesce and take effective collective action in crisis? Suzanne, what is your sign?
I am Taurus.
Also another.
I shall not
And
repeat.
You don't have to repeat them because I'm like Daniel, determined.
I can see that. All right. And next up, Jasmine Ching, right? I'm getting better at this. She's co-founder and director of Reconnect. She's academic professional experience in environmental management, community development, disaster resilience, and digital development. And her question is, how might we overcome institutional and cultural barriers between disaster management agencies and community groups, both at the organizational and individual levels? Jasmine, your sign?
I'm a Cancer, and I would say I'm imaginative, emotional. I'm very emotional. And yeah, sympathetic. So
Pathetic, I like it. All right. And I am Erin Zimmerman. I am a research associate at the German Institute of Global and Area Studies. It's actually stationed out of Hamburg, but I am here currently in Sunnyvale, and I am a Cancer. I believe one of them is loyal as well. Yeah, I'm ridiculously loyal, so that works. Okay. Thank you, everybody, for that. We haven't added on yet, folks. Okay, so next up, what we're going to do is start with just the format and note-taking. Suzanne, did you want to go over that, or just let people know that notes will be taken? I believe this is
Yeah,
also
we
going
are
to be
taking
recorded.
notes. We will put a link in the chat if you want to participate. You don't have to. We're working in Miro, which is a virtual whiteboard, and I believe Garrett is also going to try to do a Google Doc, but we have not set that up yet. So we'll let you know when we have that.
Okay.
Unfortunately, I'm having technical difficulties, so I'm taking notes offline.
Okay.
All right, and just some ground rules, these probably don't bear repeating, but we just expect everybody to be civil with everybody else, please. If you do agree with someone, you don't have to restate what they said. Just go ahead and you can say ditto or yes, and to further expand on the idea. We are holding it to a 2-minute rule, so please be as brief as possible. Obviously, if you're saying really great stuff, then we'll let you keep going, but otherwise we might try and keep the conversation rolling. All right. For the topics of discussion, this is going to be great here. The discussion prompt was originally, what would a narrative of crisis response that encompasses both institutionalized and grassroots efforts look like? So that is our broad topic today. A couple questions that we have that sort of come out of that is, what role would grassroots crisis responses fill? What changes are needed to get there? What knowledge is needed to get there? What obstacles are there in getting there? And what questions need to be asked and answered? So again, the question is, what would a narrative of crisis response that encompasses both institutionalized and grassroots efforts look like? That's what we're going to be aiming on answering today. Okay, Duncan, I have been told that you have an opening pitch. Are you ready? Duncan does not look ready.
I do.
Okay. If you
No,
want to
that
go
was a
ahead.
question. I
Okay.
do.
I sent you an email. I sent you an email, and I was hoping you had gotten it. If you would you like to take, since I appropriated Duncan's changing the narrative meme, so I thought it only appropriate that he get a first shot. But if you're not ready, if someone else has something they'd like to throw up for a start, but Duncan.
Maybe, given we've only got a limit of 2 minutes, that sounds perfect. So I'll
Get us started.
So a narrative of crisis response. Sorry, could you maybe put the question into the chat, please? It would just be good to have
Absolutely.
that as a
Yep.
memory aid. So when I think about a narrative of crisis response, you know, looking at institutional and grassroots. There's more things coming into the chat. Yeah. One of the things that we're trying to do in the UK is to change the current narrative. So the current narrative, well, in terms of volunteering, which is, I think, the original conversation I had with Suzanne, the current narrative was very much around we need to keep volunteers behind a cordon, and that cordon on one side is the public side, and on the other side is the side for emergency responders. And so we worked quite hard over 10 years to change that narrative so that that cordon began to get a little bit lowered, and that spontaneous volunteers and some other parts of the voluntary sector could begin to cross across that cordon. Now we see a new narrative perhaps needing to emerge following COVID, and that narrative being that institutions do not own the emergency, do not own the crisis, they do not own the cordon, and that we need to think about how we can involve communities much more strongly in that. Community resilience used to be the narrative, but in the UK at least, we have found it very difficult to have traction in that because it's such a vague concept, and responders struggle to have confidence that community resilience is clear and present. And so the narrative that we're trying to change is all around that. I'm coming particularly over the last year where we've been very, very intricately and intimately involved in the COVID response, is realizing that this is an opportunity for us to change that narrative now so that we don't fall back to our old narrative of where is the cordon. I don't know how long that was, but maybe I'll pause there.
That was great. And I want to know if anyone has any responses to that. How does your research reflect that as well, or not? Or what is your take on how we would change the narrative to reflect this new narrative emerging?
So Daniel here, I'll jump in. I think that's a great point. And I would wonder, is it that the narrative is different, i.e. that the story that we're telling about what's happening is more accurate, or the actual way things are going is changing? That is to say, is it true now that, for example, top-down disaster institutions are recognizing the role of local communities, neighborhoods, and NGOs? Or rather that the story that we're telling now is bringing back into the reality what was always there, that disaster response has been about emergent groups, local volunteers, neighbors helping neighbors. And I think, for me, watching the COVID response across the world, I think to me, it sounds more like the narrative is finally capturing what's actually happening on the ground.
It's Miguel. I think it's a little bit of both. I think, in my opinion, the work we have been doing is basically assessing the capabilities of emerging groups and organizations, what we call collaborative aid networks. And we have been developing the concept of social assistance networks for disaster response. And I have seen the transition. If we look at the example of the NBOAD, at least in the US, where it wasn't completely a participatory organization, even though it was meant to consolidate many NGOs and other response organizations. Not everybody was invited to the table, or not only the table, but to share the information. I think more and more they have realized that these groups are needed, that they are the heart of the response to whatever event it is. Depending on the location, there are different capabilities. But I think I will also point out to the narrative is that we need to work on integrating that. Acknowledge what are the advantages of the institutionalized response and what are the advantages and constraints of these grassroots responses, and then finding mechanisms to couple them. And we always look about the blood system or the circulatory risk system, where we have the large organizations bringing all the blood, but all these grassroots efforts being the capillarity vessels that goes everywhere.
I can jump in with 2 points. Expanding narrative with the idea that the professional groups that come in, volunteers or government or international, have a task of being disciplined and trained and structured. At the same time, when they get into the environment, they're faced with a very evolving, local, emerging group aspect, and they have to be simultaneously disciplined enough to do what they do, but agile enough to expand what they do and recognize what they're not able to do. And the second point is that by looking at this, I started out and people were talking in organizational learning, and having been involved as an actual responder, I was more interested in organizational forgetting. How do we forget to do things? And it's really a function of the fact that we're talking about, at least for a locality, these events are rare events. Which means they don't happen very often. So that if you look at an organizational structure locally, the chances are that the people that are in the positions of responsibility who went through the last one are home retired or moved or gone. And you're really dealing with a relatively inexperienced organization, even though the organization itself has tremendous experience. The people who are on scene may not.
So I really liked Miguel sort of talking about a capillary system and how the organization is like the vessels, and then the local community groups are capillaries. Is there, I'm trying to sense it because there's sort of a social media aspect to this, is how do you get the communication between the vessels and the capillaries, because they have to work together to get things, and it sounds like there's this cordon that Duncan was talking about preventing this interaction between the vessels and the capillaries. How do you break that down in terms of crisis response and capitalize on local knowledge?
I think part of it is having in your structure, having people who are tasked with, that's a formal responsibility to track the local emerging groups and experts and structure that. Because we all know for these groups that form at a time of disaster, if you come back 20 years, they still exist in the community in many cases. And that's the continuity. But my experience in some of these events is the organizing, whether it's FEMA or any other organization, is overwhelmed by the number of people who show up at your door with a good idea or a good resource, and we can do this, and who you support and who you tell, no, that's dangerous. All the ideas that you hear are not good ones, and there has to be a quick way to evaluate and dismiss or encourage what's going on, and that typically is a very ad hoc thing. It should be part of the formal structure.
And we've got a couple people who haven't said anything yet. Jasmine or Jongwon, did you want to weigh in on this about the narrative? Happy?
Yeah, I'll say ditto, especially it's illuminating to remind ourselves of the continuity issue of Jack, and also I quote your paper in my thesis, the discipline and agility talk, and then also just reminding ourselves of people who have left and not happening enough in institutions, but in communities, that kind of knowledge is, the continuity is very important. So, yeah.
All right, we can go to a more specific question. What role in disasters should grassroots organizations fill, particularly in relationship to this community knowledge. Never had a group of academics be so quiet. This is shocking. Usually it's hard to get them to stop talking.
Could you repeat the question?
Sure. One of our questions was, within the narrative, what role should grassroots community organizations fill?
So Daniel here, I'm happy to jump in on this one. So I think two different ways. One is helping local residents have a voice in both the immediate short-term recovery and processes and the long-term planning processes. And that's going to be helping sort of horizontal ties. At the same time, those NGOs also can form as vertical ties, like it's the capillaries metaphor, to, for example, regional, local, and national governments, which have the resources they're going to need. And those local groups are critical elements in this, because otherwise the recovery may be a cookie cutter one, determined by people well beyond the community who already have visions for what a recovered community would look like.
I think they are one of the critical sources of information during the disaster response, connecting the knowledge or the lack of knowledge from the incoming and external organizations to the community. They can also do services for civic society during different type of crises, keeping calm or giving information. And also something that we have been looking at is how they can help in the optimal allocation of resources, especially scarce resources in disaster response.
So we know what their role is. How do we, is that what's happening currently in disaster response? Speaking from a non-disaster response perspective, is that what's happening currently? And if not, how do we get there?
I think what happens, and I've been out of this for a few years now, but in my own experience was, there's a day when, I call it the day when people want their trucks back, they loaned the responders and everything. When you start actually counting your resources and pulling them out. And then the locals take over. And so the question is, has there been any transition to the local organizations? And more importantly, is there any plan to support these organizations to go from whatever the immediate recovery phase was to longer term things? You can still travel around in the United States and go to areas that were hit by hurricanes and still see tarps on roofs from events that were 5, 6 years ago. It just never transitioned to any real economic recovery.
I think in part that's informed by the agency of the communities that have been affected. So if they are ones that can be easily ignored, then they are in charge of their own recovery. If they're ones who are able to mobilize and become a disruptive force for good, then they may be able to influence the institutions. But those that perhaps are able to become a disruptive force maybe are the ones who are able to take control of their own agents, of their own recovery even more than the ones who maybe struggle. And so there might be two or a continuum of different abilities here, and a different willingness of institutions to listen.
Yeah, I think what I'm hearing is there's this both the metaphor of the capillaries, that those people working at the fringes, how do we integrate them into the main, the major circulatory system? The idea of a cordon, people being able to help weaken that cordon and integrate resources better. What about the situation where we have those grassroots crisis, those grassroots responses that are not working with the system? A lot of the conversation I hear in the current narrative and reality is looked at from the response system organization, that main, what we think of as the main capillary system. But what about those responses that start spontaneously and are functioning and work differently from the main response system? They don't necessarily, should they be integrated across the cordon? Do they have to be? Do they want to be?
From what we have been looking at is there needs to be, and I mentioned this before, a mechanism for integration. But there are there are some capabilities from these groups that we don't want to constrain. And those are the constraints that the large organizations may have. For example, even though we don't like that they are not keeping track of the logs of how much they gave to different people, or if they had to give a bribe to a different organization to allow them to get access to this part of the city or town, that's what allows them to actually be able to be effective and get to where some organizations may not be able to get in, because they don't need to keep numbers. There's not going to be somebody that after the crisis is going to come and say, hey, you received $20 million and where are those $20 million? But at the same time, this lack of standardization is one of the risks of these grassroots efforts, because we can have a different behaviors that people have. We have seen really good ones, and we have seen not that so good ones in terms of what they actually do. So there is a risk on that informality of these emerging groups.
Could I probe a little bit on the informality and like no constraint? Could you tell us a bit more of, is that kind of not, particularly with funding or resources, is that kind of the community group's wish not to be tracking, or is it because of there's a lack of resources or a mechanism for them to be tracking how they're managing their own the resources that they're managing as an organization themselves? I
mean, and maybe I have a different view, but some of these organizations may be a person that was at the school in the off hours, the disaster happened, a lot of things started to come to a school, and that person became this manager of the local response. And then that group started to grow up. So there may be people that have no experience at all in disaster response. And that's one of the, we go back to the sociology literature, that's one of the definitions of this emerging organization, or type 4 from Quarantelli and other researchers. So they don't have any prior knowledge. The objective of what they did may not be nothing compared to what they are doing during the disaster. So we have all this kind of variety on these grassroots efforts.
Understood. And I think there's also the discussion around in what areas and which groups should be temporary versus for long term. So for places like Puerto Rico, where I'm working at, there are lots of groups that they turn from emergent groups and kind of grew into more permanent groups because the risk of disaster and is recurrent, and also recovery is long term, and that the ability for the government to provide for them does not very much exist. So they have to, in a way, formalize and grow into some sort of an organization. So the need to put on quote unquote constraints or a mechanism, even for emergent groups, are also necessary in some ways, from my understanding of working with them.
Well, the issue in that phase is money. If money is coming from the central government or other governments, who helps prioritize and ensures the spread of money around these various organizations corresponds to the needs. It's interesting in natural disasters, and that doesn't typically happen. The money flows in kind of a random way from random sources. But a technological disaster like Deepwater Horizon, where you can sue the cause of the disaster for $1 billion, then you have money to actually support a lot of these emergent groups. And in the Gulf of Mexico, you can contrast the emergent groups from Katrina with the emergent groups that came out of Deepwater Horizon, and it's two very different trajectories. One starts with no money and one starts with $1 billion. Guess which has more activity?
Very true.
And that's a good point. And some of these organizations, and basically almost any NGO that I know, have two basic clients or stakeholders: the people that they need to serve, and the donors, the potential donors. So I think the effective ones are the ones that are able to attract the funding that Jack is mentioning to be able to accomplish their objectives. And going back to Erin's media question, I think it's also, they are a major stakeholder in disaster response and crisis management, because they I mean, media also wants to attract viewers, and they may only concentrate in one part of the response, the one that attracts viewers to something that is happening. And there may be organizations that are acting in other places that didn't get that much coverage. So I think we have many different stakeholders in disaster response or crisis management.
I'll just add to that. I recently read an article I'll share in the chat of how media attention has actually led to issues around organizations not collaborating because more media attention has led to more resources for some. So from a donor perspective, organizations, they want more funding themselves. So sometimes that's led to a disincentive for collaboration, which is a problem.
Mm.
So.
Well, the funding stream for emergent groups also creates a competitive environment on the ground from a place where you really, changing the narrative, you'd like that to be a collaborative and reasonably funded effort. And it turns out, particularly once you get 6 months to a year out, resources are drying up, and the emergent groups that come out and local groups are competing with national groups for available funding.
And so another question I sort of have is, for some of these groups that emerge right after crisis, they emerge organically, like Miguel was saying, you know, someone just happens to be in the right place and the right time, and they perform whatever they need to do. And then once the crisis is passed, do those groups need to be integrated into part of a larger framework? Or is their function just to emerge in that time and then to dissipate after the crisis is over?
I think there's great benefit for them to collaborate. I know that after Hurricane Katrina, there were several efforts to have collaborative processes work, which had various levels of fairness and not. Going way back to Hurricane Andrew, I can imagine I was part of working with the Red Cross by that point, and they just walked away from working with emergent groups and it still exists today, and they're still not working with the Red Cross. But they actually formed in the Red Cross conference room. We got the people together that were working on various recovery issues, and they said, well, we'll do it ourselves, and they're still existing.
Why did they walk away? Why are they not collaborating with the Red Cross?
The Red Cross just didn't see it as part of this was the disaster responders, or our time is up, we're pulling out, it's your problem now. They didn't see that as a tasking to the local Red Cross to become part of that. And that was a structure internally. At that point, the disaster services in the Red Cross was a national organization. So you came in with your experts, and your local people were pushed aside, and they did what they usually did. And then when you moved out, there really wasn't any continuing process. And that's probably true of most response organizations. No vestigial remains of what they left, and no caretaking of growing the initiatives that were started. They're on to the next thing. And unfortunately, as Suzanne points out, there's always the next thing.
Mm-hmm. All right. And then I wanted to, before we run out of time, I know a lot of people are focusing on COVID-19. Now, COVID-19 is a bit different than the traditional disasters we're thinking of. It's not sort of localized to an individual place. You know, it's not a hurricane, it's to a geographic location. How has this sort of changed the way people look at disaster response? Or in your experiences, what has emerged that's different with COVID over other types of disaster responses? Well, I know we've got a lot of COVID-19 people. I read the bios.
I can toss in 2 points. One, from a perspective, at one point in time, I was Center for Disease Control had a scientific advisory group, and I was on that for a couple of years. And the task of our task was reviewing the preparations, and their multi-million-dollar operations center. They had the framework. They fully expected in the pandemic that they would be operationally controlling the public health response in the United States. when it occurred, they were unplugged. It just didn't happen. The people that were the talking heads were the former executives that we worked with 8, 9 years earlier. So, you know, there is the ups and downs politically. On a more hopeful note, when I live in a rural county in Maryland, on the eastern shore of Maryland, and yes, disaster researchers living in the floodplain. But we are fortunate to have an emergency manager who's retired from the state emergency manager counter. So this little county has a highly skilled guy who put together for COVID a response, which I said the one voice response from the county, with all the emergency manager, the emergency medical services, the public health people, the hospital, the mental health, social organizations were all on TV with spots recommending mask wearing, now the vaccinations, and the compliance was incredible. And we've avoided, been very low rate of incidence of disease, but it was a combination of relationships that were foreseen at the national level by people who planned it 10 years ago. And the point is that we never tried to do that at the national level, but it worked at the local level in a very small county, 33,000 people.
And that's what I was thinking, in the absence of a coordinated federal response. I know that a lot of counties or states sort of took over, or local organizations. Any other perspectives that people want to share on the response to COVID-19?
I can talk a little bit about this. Sorry, everyone, I was a little bit late coming in. My name is Tiffany. Hi, it's nice to meet you all. But since the COVID-19 crisis happened, I've been focusing on community-based care, such as mutual aid organizations. So me and my collaborator, John Wan, who's also on this call, have been following some of these organizations kind of since inception. Most of them began, in mid-May or in mid-March of last year, right as like lockdowns were starting to happen and people were starting to panic about the virus. And I've actually spoken with now 10 different organizers across the country of these groups, and learned a little bit about like kind of what they initially were all about, kind of like those immediate needs they were trying to serve, as far as like getting people information and making sure people who had lost their jobs were equipped with food and that type of thing, to now shifting towards this kind of like long-term, more like social justice driven response, which I think is addressing like a different part of the disaster. So initially it was addressing the very immediate part, when everything was unknown. And now I feel like it's addressing more of a like social equality disaster, whereas the COVID-19 pandemic like really made visible a lot of needs that were already there and really affected people who were already in a precarious position even more so. And so it's been interesting to see how they've kind of gone about some of this, as far as like connecting people to each other in local communities to help each other on a very like person-to-person basis, as well as connecting people to nonprofits that can help them with things such as rent relief or food or whatever. But also looking at how people are organizing in these groups to promote more like social justice driven initiatives for long-term like solutions, such as there's people in the group who met each other that are now running for government positions in their local governments to try to facilitate change. They're starting new organizations, they're working on police reform, and all of these things that are very like interconnected, but not directly related to the virus. So it's been
evolved
interesting
into something
to see
else.
that. Yeah, it's been interesting to see that kind of come out of this, immediate needs. We have to make sure that people are housed. If you need to find a COVID test site, here's the information.
Something else. Oh, thank you. Thank you very much, Tiffany. I'm glad you were able to fill that in. All right. I am cognizant of time. So we are going to do a quick wrap up. I'm going to go around and just really quickly ask everyone to give us one sentence of takeaway, something that they learned or what they found valuable in the conversation. And then Suzanne will give you a overview of the next steps. So why don't we have you start as well, Suzanne, your one takeaway.
My one takeaway is that I am still hearing this the grassroots crisis response, we have to find ways to integrate it into the major response. And not the question of, to put it boldly, what right do we have to do that? Is there a right for grassroots crisis response to emerge and do their thing, and a need to support them in the way they need to work and how they need to emerge, and then think about how do we support them, work with them, and possibly help them that effort transition into the more integrated response at a later point. But I'm still hearing that, how do we absorb? The starting point is we need to integrate them.
And I'll move on to you, John, or Jack, sorry. What's your takeaway?
Would you call on?
You.
Oh, that's why nobody's speaking.
If you would please.
I think the takeaway is that as you move away from the event that you're responding to, it becomes more relationship building and less skill development. You're building and supporting relationships that live on is a critical response and recovery role.
Excellent, thank you. And Miguel, would you go next, please?
We need to educate institutionalized or institutions and also potential grassroots organizations to what it actually takes to be working together in disasters.
Mm-hmm. Excellent. Duncan, would you share your takeaway?
I just like the idea of capillaries and vessels, and it chimes with some of the other work that I've been doing around viable systems. So I quite like that idea.
Yeah. And Jasmine?
I'm taking notes. Yeah, it's great to hear, because we're building a technology system trying to tie all these things together. So it's great to hear a lot of that education about continuity, about training and education, and the challenges around competition. And really all of this goes back to relationships and connections and the barriers that's been there, power structure, and back to the question that I raised in the beginning, how do we get over these barriers? So.
Mm-hmm. Excellent. And Jongwon, did you want to tell us your takeaway, please?
Yeah, like related to Suzanne and what Miguel said, I still think like research in this domain is still like divided. It could be divided like because institutionalized disaster response is more top to bottom, in like civic responses is from bottom to top. So people tend to like regard it as a two different thing, but although it can be like it can complement each other because they have like different benefits. So yeah, I think there's a need to integrate both two different ways to recover from disaster.
Excellent, thank you. Garrett, did you want to contribute, or are you busy taking notes?
No, let's contribute.
Okay.
My takeaway is that there needs to be a systematic way that the institutional response has to then foment the local response as they pull away, or as they have need for that final, the last mile. I agree with Suzanne that when the local response occurs by itself, we need to support that. But I'm also hearing a lot about the institutions going in, doing their thing, which might be great, and then pulling out and leaving a void in their wake that is as bad a disaster as the original disaster. So that pulling away should include a systematic handoff to local groups that are there, or a systematic campaign to produce local response that might not have happened already.
Excellent, thank you. And last but not least, Tiffany, I know you just joined us recently, but if you've got a takeaway, we'd love to hear it.
Yeah, I did just join recently. I think I kind of came in with a little bit of that, hearing a little bit about the emphasis on relationship building and how important it is to keep those relationships active, especially around things like training and different people's specializations, so that, you know, when the disaster strikes, people can call in the right folks.
Excellent.
Important.
No, that's very true. The active relationships. Appreciate that. Thank you. All right. Thanks everyone for contributing. Suzanne, if you would you take everyone through the next steps and what they can expect?
So we have been recording, and we'll have that recording transcribed and send it to you probably in the next week or so, a transcription and the recording, so you can review it, see if there's anything you feel that should be redacted before it is published. We will also be writing a summary of what we have, and this last wrap up gave me a couple of insights on some of the deeper themes that we've been circling around. If anyone would like to help with writing that, we would welcome the help. We will also be sending you a questionnaire or reaching out to hear what we could do better. Obviously, starting when the meeting was scheduled, not leaving that slack time, but other things you can do to help generate a lively discussion going forward. And Jasmine, you have some thoughts on some topics we're talking about for going forward, next sessions?
Or not to take the credit, it's, you know, everyone's. So a couple of things that I think Suzanne and others have contributed include what grassroots and emergent behaviors should be cultivated or standardized in disaster response. And I think the conversation we had with Duncan last time about understanding of their risks and the kind of things that they're involved in. The second part is around the linkages between social networks and social capital and grassroots crisis response, as Daniel had talked about both the vertical and horizontal ties. And does that increase or improve the social network? How does pre-existing social capital lead to social emergence response? And then does the emergence response lead to a change in social capital? And the last part is on the implication of experiential learning methods for crisis leadership training. If there are other thoughts right now in the room, we can add them to the list.
So those are future sessions we're considering. We will certainly reach out to you. We will also send you an invite to a mailing list. We will not be offended if you do not accept it, but the intention is that we can keep going on this discussion. Obviously, we'll also be thinking about topics based on this conversation, things that have come up here. And with that, I think we will wrap up the formal session. We do have, if anyone wants to continue the conversation here, I know there are people who still has a few things to say, we can keep going. Erin has to drop off, and I want to thank her very much for a good job and for her contribution.
Thank you everybody for educating me. I appreciate it. I wish you luck.
So I know, Duncan, you had something that you were.
No, I was just going to say thank you very much, and I wish you all a very nice weekend. My weekend is starting perhaps a little bit earlier than yours is, so have a good evening and a good day. Thank you very much. Bye-bye.
Thank you. Bye, Duncan.
Tiffany, I actually have a question for you on both of you on your mutual aid network research. It's very interesting to hear kind of the transition going from, you know, caring for around the basic needs around food and to going into social movement, which is very interesting actually in Puerto Rico, where some of these political assemblies have turned into mutual aid groups in Limeray and the earthquakes that happened last year. So kind of this in overall of the kind of sparkles and relationships that could generate through these meetings are kind of probably the basis for citizen-led change in society, and that's very, very exciting to see. Do you have examples for like which groups, what region, does it matter like where, and kind of like their existing social how did that happen? And
yeah, I can speak a little bit to this because I did most of the interviews. I mean, John One's I think familiar with this as well because she's read through the transcripts. But I talked to most of the folks in the mutual aid organizations, and it seems like in places with a strong activist network that was like pre-existing COVID, they had an easier time initiating mutual aid. More people were familiar with what it is. And to a certain extent, this type of thing had already been happening in the community. So when COVID struck, more people, of course, joined the group because more people were, newly in need. Everyone had questions about COVID. So I think that the groups were able to bring in people who hadn't been part of mutual aid before. So I think in areas where there was more activism, more social activism already, it took on like this different flavor maybe, in that, it was open to anyone who wanted to join, but there was also a very like strong undercurrent of like social justice initiatives. So, getting at kind of maybe more of the root cause of why, you may need food or why you don't have a place to live or you lost your job or whatever. Whereas in other places that were not, I guess, so radicalized beforehand, such as, for example, I interviewed a group in Northwestern Arkansas, and they were like, yeah, we're two people that are very, interested in, activism and making the community a better place. However, we're very surrounded by a bunch of people who don't understand us. So there was a lot more education going into what is mutual aid, how is it different from like a garage sale group? How is, like how do you behave in a mutual aid group? It's not about judging people's experience, it's about helping them. If you can't help, move forward, just leave it alone. So there was like more education going on. Yeah, is that getting at what you're looking for?
yeah, absolutely. And maybe the question for everyone is that, again, kind of this continuity part, and a lot of the mutual aid work, they talk about, it's solidarity, not charity.
Right.
But because these are organized by, as Miguel, you said, it might be a school teacher, it might be someone who has another job and who most you're not getting paid doing what they do. And
Right.
a lot of people that I work with in Puerto Rico, they had to stop doing that because they couldn't provide a living for themselves, and it's so much work in community organizing. But then on the other hand, because of kind of their ideology that often clashes with the philanthropic entity, especially again in places like Puerto Rico, where there's a lot of conflicts and historical issues between residents and governments, but then the government and the big entities have the money. So I don't know if you all have ideas around if in places again like Puerto Rico, they need this long-term, at least for now, for a while, long-term engagements at the grassroots level, but then they also need the money and finance to keep going. And what do we do? What do they do?
Right. That is a challenge that a lot of the people I've interviewed brought up. Some of them were like, we want absolutely nothing to do with a nonprofit. We think they're terrible. They don't help us. Here's some examples of how they didn't help in the past. So they're really big on soliciting donations and trying to form partnerships with organizations who will just be basically their donor, and just give them money for the mutual aid group to distribute as they see fit. And there are other organizers in mutual aid groups who are just like, you know what, we don't do cash. We just don't do cash. We don't want to deal with it because then we have to be accountable to it. So if we get a donation, we just basically will buy food with it. That's what we'll do. We'll just buy food. And then people who can have food or whatever. But I think it's really kind of dependent on how connected the organizer is and what their perceptions are of nonprofit. And then going back to your point about being like overstretched, a lot of them did mention that this was basically another full-time job that they did. And so, for them, it was about finding, people to help them moderate the group that were trustworthy, that they could pass some of this responsibility off to, and like organize sort of working groups around different initiatives that the mutual aid organization was trying to address in the community, whether that be food security or housing or rent relief or whatever it may be. So trying to like offload some of that on other people that were interested and willing and able.
One other task that these emerging groups can help in is educating and changing the risk perception of the general population. I know that's been a frustration everywhere. We did some survey work around here. As I said, we're in the floodplain from down Chesapeake Bay, Eastern Shore. And the level of risk is fairly well understood, but not any understanding of what can you do about it. What are the options? Where do you go for help? And it's just the sort of the subject in the closet no one talks about. And that's true, I think, in most natural hazard and technological hazard areas, or in areas like in Texas, where you have every natural hazard spawns a technological hazard along the way by blowing through a refinery or a chemical plant or something.
When you say change the perception, who's doing the changing and of whose perception in this case? Are we talking about the volunteers or changing the perception of other residents or of the officials?
Changing our perceptions of the residents. It's got to be a cyclical process. I mean, the leaders should be speaking in terms of, we don't do a good job of risk communication on any level. And when you do surveys of people's risk perceptions, you realize it's a lot of people, it's a 50-50 risk. It's either going to happen or not, and that's their view. We don't teach probability in our educational system, so it's a difficult job. So but if the risk message comes from within the community, it's listened to more than it is if it comes from outside the community. So one of the things you can do with these emerging groups is educate them to make sure they're aware of why they need to still be in existence, basically. And that can be clothed as an assistance in writing grants. And they perk up to that a little bit. If you'll help the nonprofits write the grants that they need to do, then you can help influence the message that they spread.
I think that's a really important point, because although there were some groups that said like we're going to continue doing this kind of like initiative of helping each other even after COVID, there were some other like organizers saying like we even during COVID, like we had trouble because the participation rate is kind of like waning down because this is such a long haul disaster. And related to like how Jasmine mentioned like how they get resource, I noticed that lots of mutual aid groups are really trying to become like really self-organized. So to feed their neighbors, like they start doing like community gardens, so they can use the food from gardens. Or they also mentioned that lots of people who get support from those mutual aid groups try to support other people who are struggling through mutual aid when their situation gets better.
Miguel, I saw you on mute. Did you have something you wanted to jump in here?
Yeah, there's an additional dimension, and I think it's back to what was just mentioned. It's about trust. People need to trust somebody, or we want to trust somebody, and usually it's easier to trust somebody that is part of my own social fabric, my own community. Even if it's for bad news, even if it's for them telling me, hey, aid is not coming, we're not going to get vaccines in 3 months, but at least I know that this person that is giving me that information is in my best interest and not some foreign entity just pushing me or shutting me down.
Yeah, and I think it goes into something that's kind of emerging for me out of the conversation here is that whole, first of all, the time spectrum, where on the initial early stages, you do need that emergent response. There's an institutionalized response that may or may not happen. Then as time goes on, the institutional comes in, and that's where we have this need to integrate and bridging. And then on long term, it may need to, it for many organizations needs to transition back to more local responsibility, which may be a continuation of emergent. It may be pre-existing organizations that take over, however that happens. But that there's that whole, this top down, bottom up profile changes over time. And with that change comes with I think Jack brought in, or talk about the skills versus relationships. Is this a skills-based, do we have skills-based response needs, or is it relationship building? Where some of those skills that Tiffany started bringing in was the skills of relationship building, right? There's hard skills, and in that skills, and especially the skills for relationship building, we get into those issues of risk perception and trust. And how do we have the skills to talk about them, deal with them throughout that profile?
There's also one way to look at it. There's a period after an event and you're into the recovery phase. But you're still in the teachable moment, actually, where you can educate. I had the opportunity to spend a semester in Turkey after the Turkish earthquake. And at that point in time, everybody was very well aware of earthquake engineering and structural integrity, all the things to do, and civil engineers were making lots of money on the side and inspecting buildings. But there was a societal move to make a difference. Well, that disappeared. Now, if you go back, it's all that is gone. And you have that teachable moment and you either take advantage of it or not. Because once it's by, it's gone.
And that's an interesting point, because it's the teachable moment for both for communities, but also for that integration we're talking about, helping the institutionalized response system learn to capitalize and integrate those emergent responses or work with them.
It's a teachable moment with a willing audience, and those two things don't exist in parallel very often. And unfortunately, the formal response organizations at that point are more interested in packing up and getting home and accounting for resources and doing the administrative work, and that teachable moment just gets by them.
Miguel, were you trying to get in here? I think you're muted right now. Oh, nope. I see you talking, but we're not hearing you. Nope, can't hear you. Do you run out of battery? You want to do it? Can you do it on the computer audio? Just your built-in?
Can you hear me?
Yes.
Yeah, sorry, I just ran out of battery, as you said.
Did you want to add to the teachable moment conversation there, or that risk profile?
Sorry,
I think
I couldn't hear anything for the last 40 seconds.
Yeah, Jack was talking about the teachable moment that happens right after a crisis. You know, the best time to both educate and to gather money, whatever, is right after the event or in the event, right when all the hype is happening. And we were talking about how for the opportunity, the teachable moment, both for helping the community develop the skills we're talking about, laying down the basis for those long-term needs. And I think that's an interesting point in response planning, is how do we build in the continuity and the long-term from that get-go when we come in. That has to transition to local, but that the teachable moment for the community, but also for the institutional and formal response systems, where is that opportunity to help them learn to integrate and work with the emergency responses in future events?
Well, I don't think, well, in my opinion, I don't think the teachable moment is when the disaster happens. We cannot teach people to swim when the boat is sinking. We need to do it well in advance. And I think one of the first things,
Recovery process.
the recovery process, correct. Well, the preparedness and mitigation process. But I think one of the things that we have been struggling for many years is to make organizations understand that basically none of them can do this alone, and all of them will require the support, even if that support is coming kind of on the under the table, is not being acknowledged, is not covered by the media. But a lot of people kind of survive a crisis by these grassroots efforts that nobody is logging in, that nobody is probably, and we don't have enough people to interview all these all these grassroots efforts, but they are needed because we have done the math, and even the most powerful organization, the largest organization, won't be able to support alone what is needed in a crisis and event. So we need to teach everyone well in advance that this is going to be a need to survive the next crisis.
And I think the teachable moment was when can you get people as a willing audience was, I think, the phrase you used, Jack.
Yeah.
Or an interested audience.
Well, in that case, yes, I will agree. Is when the cameras are on. As soon as the media loses interest, there is no more money. Well, there's still some efforts, but people is highly. We can be managed by what is portrayed on the media. If we have two disasters going on at the same time, and only one of them is being covered, that's where people feel connected to.
Right.
So yeah.
Yeah, and we have the evidence that the response money follows the media, unfortunately. But I think it's an interesting question in terms of educating around this grassroots, the emergent response, both getting people the skills to make it happen, which is what creative crisis leadership is about, and long-term, how do we help integrate that into the institutionalized, the formal response, and getting the formal response system to accept, as Miguel says, recognize that don't keep going. You guys stop what you're doing. You're not doing it right. Get them to say, well, how do we work with this? How do we leverage? Because we can't do it alone. How do we create the teachable moments in advance? And I think, Miguel, you're absolutely right. If you can engage the media in creating that moment.
I will also add that, and I don't know if this is well known, and I apologize, but disasters, they evolve, and we may have different waves. I mean, we're getting the COVID waves, but that also happens in different disasters. And some of these things may be for the long run. And as you are pointing out, some of these organizations may don't want anything to do because they actually get burned out. If you look at the large organizations and you go to the field and you interview them, 2 weeks later on, you come and the entire team have been changed. But these small organizations, they don't have that capacity. So that person is stuck on that activity for months. And they may not do it again. So we need to find a way that if we need them, how we teach them that this is what they are getting into if they want to go to be an emerging organization. Because in most cases, the initial need may have a huge jump, then it kind of tampers down, and then we'll get kind of it doesn't need to be the longer term recovery aspect of the phase, but it could be that, well, we had the disaster in Haiti at the beginning, all the media was there and a lot of organizations went, but then the rainy season came in, and then we have floods, and then we have cholera, and then we have kind of these cascading effects that were now not part of the initial impact that attracted a lot of the attention and the effort. And that those later on impact, those cascading effects, still require these organizations to be on the field, but they may not be anymore because they were burned out in the initial phase of the disaster response. And I see that happening. I don't know, all the people in Nextdoor. I don't know if you are in Nextdoor in your communities, but offering to buy food for the elderly, going to do the grocery shopping at the beginning of the pandemic. You don't see that much anymore. You don't see kids volunteering to help the elderly because we feel that the pandemic is already over, that there are no more needs, that everything is fine in some places.
Yeah, I noticed a similar thing in the mutual aid groups, talking with some of the organizers. Some of them had specifically mentioned that the activity in the group evolves as the perceived infection rate is like evolving. So like as cases get worse, more people are in the group, oh, things are easing up, okay, people leave it alone. But also, it kind of goes with like the COVID waves, but it also goes with how much money people have at their expense. So for example, when stimulus check goes out, the group activity dies down. When stimulus money runs out, everyone's back. And so it's kind of like being able to anticipate when these things might happen, to be able to activate different parts of like the mutual aid organization. Because like I know a lot of them work in like smaller kind of sort of like focused areas, to respond to different needs and try to respond to them quickly. One of the big things is like making sure that there's funds available if they need it. Like some of the organizers had said that they even got donations from other people in the mutual aid group. Like somebody gave a stimulus check to a group organizer to redistribute, or that type of thing. But I've also, basically I've seen like this kind of happen based on the activity in the community, the need in the community as the disaster evolves.
Yeah, you definitely see that as both the needs change and as the situation changes, especially with the emergent responders, they have to go back, things go normalized, they have to go back to work. They don't have the time that they had right after the event. And that's where it has to transition into a more sustainable response. And I think one of the possibly mistaken assumptions I often hear is the assumption that it should be the same people, that it needs to be the same people. We've had some emergent response. Oh, now you need to become a stable organization and regularize, where the fact is that initial organizations, first of all, it's not the same skills, it's not the same kind of people, it's like a startup. The transition that a corporate startup, it's a different set of people, often management, everything changes out when you grow and you become a stable organization. So it's not necessarily the entrepreneur doesn't stay with the effort long term. So recognizing that maybe it's helping the organization transition, or recognizing that it just has to, if the need is still there, it has to be absorbed by an existing organization, some other organization, or it has to transition to a different group of people somehow. I often hear a lot of, oh, how can we help these people stabilize and normalize, without asking the question of, is that the right thing to do for them or for the, and that's where we get a lot of the burnout, because we assume it has to be the same people.
Right. I'm sorry, it's 12:30 and I've got something else I have to attend to. So this is a really engaging conversation. I wish I didn't have to leave, but.
Right. Well, thank you, Tiffany.
Thank you.
Yep.
Yeah.
Thank you all.
This is really good.